My favorite disease is arthritis. I love arthritis. Now, the reason why I love arthritis is it's easy to fix. And when you can fix something as horrible and as debilitating, as painful, and as expensive, and as miserable as arthritis, you get kind of excited about this concept of preventing and curing diseases with nutrition. And so I tell people about this arthritis thing all the time. So let's have a quick look at arthritis. Number one, 75 to 80% of all Americans over the age of 50 get arthritis to one degree or of one type or another. And according to the CDC, the Center for Disease Control, 35 to 50 million baby boomers are going to get arthritis in the next 7 to 10 years, and there's not a single medical treatment designed to prevent or fix it. Aspirin certainly doesn't fix arthritis, causes gastric bleeding and death. Tylenol doesn't fix arthritis, causes 50,000 cases of kidney failure each year, 5,000 which are so severe you need a kidney transplant. Then there's ibuprofen, Advil, and Aleve. These things don't fix arthritis, and they cause liver disease in 2 to 5% of the users, including liver cirrhosis, even if you don't drink. And then there's methotrexate and gold shots. These things don't fix arthritis. They subdue your bone marrow so you can't make normal platelets and white blood cells. And then you have the granddaddies of all the medical treatments for arthritis, prednisone and cortisone. They don't fix arthritis. They subdue your immune system, which leaves you open to diseases far, far more horrible than arthritis. And prednisone and cortisone accelerate the loss of minerals from your bones, something you don't want when you have osteoporosis and arthritis. Now, when these prescription medications and over-the-counter medications don't work anymore to relieve pain and inflammation, the only thing left for you medically is joint replacement surgery. And I never like to send my patients in for the joint replacement surgery because they never work out well. In fact, many times you're worse off after the surgery than you were before the surgery. The advantage my patients have always had is that I'm a veterinarian as well as a physician. And so I always used to tell my patients, look, we have all these nutritional formulas designed to prevent and cure diseases in animals, including arthritis. And so I tried adapting nutritional arthritis formulas designed to prevent and cure arthritis in pigeons and turkeys, dogs, cats, sheep, pigs, horses, cows, lions, tigers, and bears to human use. And it was no surprise to me. It works just as well in humans as it does in animals because it was designed to prevent and cure arthritis in pigs. And I've literally seen tens of thousands of people who've had a regrowth of cartilage, ligaments, tendons, connective tissue, bone foundation, bone matrix. Doesn't matter if they're 20, 30, 40, 50, 60, 70, 80, 90. I've seen people 97 years old regrow cartilage and bone even if they had bone-to-bone arthritis. If there's blood supply to that joint and that bone, they will regrow bone and cartilage. Well, of course, Harvard Medical School goes berserk when you say stuff like that. Wallach, you can't say those things. The only thing left for people when they get bone-to-bone arthritis is joint replacement surgery. And I'd agree with him if the only raw materials you're using is Tylenol and aspirin and prednisone and cortisone. We've learned over 50 years that you can't regrow cartilage and bone using those things. One of the basic things, of course, that the Harvard Medical School jumped onto, and they said, this is so ridiculous that this couldn't work. And so they took 29 patients, arthritis patients, who had failed to respond in any way to heroic medical treatment for arthritis over 15 to 20 years. They took them off all their medication, wasn't working for them anyway, lined them up for joint replacement surgery, and they said, look, for 90 days before we do the surgery, they gave them a heaping tablespoonful of ground up chicken cartilage in their orange juice every morning for 90 days. They were sort of chuckling in their beer saying nothing's going to happen. Well, here's what happened. In 10 days, these 29 people had complete relief of pain and inflammation, something they hadn't had in 15 to 20 years. In 30 days, they could now open up a new pickle jar that had never been opened without pain to the fingers, wrists, elbows, and shoulders. In 90 days, 28 of the 29 were clinically cured. Now, this is from Harvard Medical School and the Boston VA. That meant that they had complete return to the range of motion. All the pain and inflammation was gone in their fingers and toes and hips and knees and their neck. And certainly, many of them still had knots on their fingers because it was only 90 days. And you'd think they'd call me up, these professors, of medicine from Harvard Medical School and from the Boston VA, and say, look, Wallach, we have to apologize to you. We've been bad-mouthing you for 20 years, and why don't you come up to Boston? Let's talk about the whole thing. Here's what they said. Quote, after 3 months, it was clear that the drug was beneficial, unquote. Chicken cartilage had become a drug in 90 days. Now, why would that happen? Well, because you can't patent chicken cartilage. And they convinced at the U.S. Patent Office that they were using a drug to do this study, and they actually got a use patent on chicken cartilage. And you too, for $3,500 a month, can get Harvard Medical School's chicken cartilage in a capsule for arthritis. Of course, cartilage has chondroitin sulfate in it, glucosamine sulfate, collagen. These are all the basic raw materials to rebuild cartilage and bone. Raise your hand if you know what the red warning light is for on the dashboard of a car truck. Back before we had dials showing temperatures and things, they used to use the red warning light, right? It was called the idiot light. And when that red warning light came on, it meant that your engine was heating up. You didn't have enough coolant or oil, or maybe you broke a fan belt or split a radiator hose. And a reasonable person would pull the vehicle, car, or truck over the side of the road and deal with the problem so you didn't burn the engine up. Even a Mercedes would burn up if you didn't have enough
coolant and oil and a fan belt and a radiator hose. Then, of course, the village idiot, that's what they call it, the village idiot light or the idiot light. They'd be driving along, they'd see that red warning light come on. They say, I don't have time to deal with this. So they whip out their pliers, they cut the wire of the red warning light, they keep on driving. Now, even a Mercedes will burn up if it doesn't have oil, coolant, a fan belt, and a radiator hose, right? And so you really have to be the village idiot to do that. Nobody in their right mind would do that to their vehicle. How many of you know what pain is for? Raise your hand if you know what pain is for. That's pretty good. Most of you know that. Pain is the red warning light for your body. When you get pain in your foot, your ankle, your leg, your knee, your hip, your back, your shoulders, elbows, wrists, and fingers, your body's saying, don't use those joints, don't use those bones, don't use those muscles until you fix them. It's absolutely criminal for a doctor to write you a prescription for a pain reliever, an anti-inflammatory or muscle relaxant, or any of those combinations without rebuilding the bones and the joints and the cartilage at the same time. If they just give you a pain reliever, just give you an anti-inflammatory and/or a muscle relaxant without rebuilding the joints and the bones at the same time, all they're doing is cutting the wire of the red warning light. You're going to wear those bones and joints and cartilage out faster and faster and faster. It's actually a negative to be taking painkillers and anti-inflammatories without rebuilding the joints and the bones at the same time. The reason why I say no carbonated drinks, and I've been doing that since 1964, is because carbonated drinks actually will neutralize your stomach acid, and you cannot efficiently absorb minerals, digest protein, or absorb vitamin B12 without stomach acid. You have to have stomach acid, like battery acid. Doctors have the criminal belief that you don't need stomach acid, and they give you all these drugs to get rid of your stomach acid, antacids, and they give you drugs to stop producing stomach acid, right? They don't want you to have stomach acid. Absolutely criminal. You can't digest food and absorb food without stomach acid. I know most of you knew that carbonated drinks neutralize stomach acid. If you remember back 25, 50, 75 years ago, when somebody would ask their doctor to say, look, I overate a Thanksgiving dinner, and I have heartburn and indigestion. What do I do? That was before they had Zantac. They say, well, take some 7-Up, drink some ginger ale, drink some club soda, take some sparkling water, because the carbonation will neutralize your stomach acid and give you some relief, and it would. Now, if you do that 3 times a year, drink a carbonated drink 3 times a year for Thanksgiving and Christmas and Easter because you overeat during those holidays, that's okay. You're going to survive. But when you're drinking 2, 3, 4, 5, 6, 8, 10 carbonated drinks a day, you're not going to survive. Because over the long haul, you will not be able to absorb the nutrients. You're going to get some horrible combination of terrible diseases. This came out June of 2000, and this is a Harvard study on 460 junior high school girls in 9th and 10th grade. And what they found out was that those junior high school girls who drank 1 non-cola carbonated drink every day, they increased their risk of fractures and osteoporosis as a teenager by 300%. They found out that if they drank 1 carbonated cola drink, a cola carbonated drink every day, they increased the risk of fractures and osteoporosis as a teenager by 500%. Now, do you think that this is more dangerous for teenagers or adults? It's much more dangerous for adults because you only have 25% bone matrix, and you're very, very slow to recover. Where teenagers have 40% bone matrix, and they can recover in a week's time. We learned in 1957 from a turkey study where they took 250,000 turkeys, and they put them on a complete turkey pellet, trying to get them to finish for market within a few days or a week or so of each other. And in the first 13 weeks, fully half of them, 125,000 of them, died. Farmers were out there every morning. They picked them up every morning by the bushel basketful, took them to the state diagnostic lab to see what they died from. When they opened them up, every one of them had died of a ruptured aortic aneurysm. And one of the clever pathologists says that's got to be due to a copper deficiency, because copper is required to manufacture the elastic fibers of arteries and skin and other tissues, and the mechanism of an aneurysm is identical to the mechanism of a balloon on a weakened wall of a tire. You know, when you hit a chuck hole with your tire and you break the cords, the internal pressure blows a balloon. You overload that tire with weight or heat it up on a highway, it blows out. Same way with an aneurysm. When you have a copper deficiency, you get a breakdown of the elastic fibers in that artery, the internal pressure. Even normal blood pressure will blow a balloon in that artery, and a balloon in an artery is called an aneurysm. And of course, if it's in a strategic place like the brain, the carotid artery, the coronary arteries, the large arteries, the aorta, pulmonary artery, renal arteries, they blow out, you die suddenly, just like you've been shot. Well, they got excited about this. They doubled the amount of copper in these pellets. The next year they tried to raise 500,000 turkeys, and they did not lose a single one from a ruptured aneurysm. They went from a 50% loss to a 0% loss just by adding a little bit of copper to those pellets. So they said, well, maybe the same thing is true for humans. And in 1958, they started looking at copper deficiency in various species of animals and humans, and here's what they found out. The very first symptom of copper deficiency is white, gray, and silver hair.
Copper is required as a cofactor to manufacture hair pigment. Doesn't matter if it's blonde, red, brown, or black hair. And I see a lot of copper deficiency in this room. I can almost tell you which people, men and women, who have colored their hair, get pretty good at that, as being a physician. And you don't want to be like a medical doctor and just treat the symptoms. If you're just coloring your hair, you're treating the symptoms. You need to do the basic thing of take some colloidal copper. And if you don't, what's going to happen is you get a breakdown of the elastic fibers in your skin, and you start getting crow's feet around the corners of your eyes and your mouth. Parts of your anatomy begin to sag, and you know you're in trouble when your doctor tells you, look, I've got a golf buddy down the hall who's a plastic surgeon. For $10,000 he'll make you look 20 years younger. But you don't need a facelift, a booby lift, a tummy tuck, or a derriere lift. All you need is some copper, and everything will come back up just like you have a hydraulic jack under it. It'll just come right back up. Those elastic fibers tighten right up. People say, Francine, did you get a facelift? You look great. You look like you're 20 years younger. Now, if you don't take some action at that point, the next thing that happens is you get a breakdown of the elastic fibers in the large veins of your legs, and you get varicose veins. You don't take action at that point, you get a breakdown of the elastic fibers in the large veins of your exhaust pipe, and you get hemorrhoids. So if you have hemorrhoids, varicose veins, things that sag, wrinkles, white, gray, or silver hair, the odds are you have aneurysms developing in you somewhere. And you don't want to, of course, die suddenly of a ruptured aneurysm when your body's been warning you for 10, 20, 30 years. Just remember, people don't die suddenly of an aneurysm. It may be you drop and die. Think about old Albert Einstein. He died of a ruptured aortic aneurysm at 68 years of age. What color was his hair? He was famous for wild white hair, wasn't he? Now, you'd like to think that people who win the Nobel Prize in medicine would at least live to be 75.5, but they live to be 58 just like other doctors. And, of course, that's because they are trained and they believe and they practice. You can get everything you need from your 4 food groups. Doesn't matter if they win the Nobel Prize or not. This guy here, Dr. George Kohler, was the youngest person ever to win the Nobel Prize in medicine in history. 37 years old, wins the Nobel Prize in medicine. And he won the Nobel Prize in medicine for studying monoclonal antibodies, which are antibodies trained to attack cancer cells. And if they ever get this really working, it'll be great because they won't have to use chemotherapy anymore, which kills more people than it saves. 11 years after winning the Nobel Prize in medicine, Dr. George Kohler, now 48, drops dead of a cardiomyopathy heart attack because he believed you can get everything you need from your 4 food groups. Didn't take any selenium, died of a cardiomyopathy heart attack. Now, I have to tell you why athletes are early warning system. Couch potatoes, by definition, are people who go to extraordinary efforts not to sweat, right? They make every human effort not to sweat. They're changing the TV channels. Honey, bring in the popcorn, I'm changing the channels. Son, bring me the TV guide, I'm changing the channels. By contrast, athletes have the attitude, no pain, no gain. And they're out there sweating and working away, power training, strength training, running, and they sweat. Athletes, no matter age, they sweat more in 5 years than couch potatoes do in 70 years. And when you sweat, you don't just sweat out potassium and Gatorade, you sweat out all 60 essential minerals. If you sweat out all of your selenium and don't replace it by supplementation, you're at high risk of getting a cardiomyopathy heart attack. You sweat out all of your copper and don't replace it by supplementation, you're at high risk of developing an aneurysm and dying suddenly of a ruptured aneurysm. You sweat out all of your chromium and vanadium and don't replace it by supplementation, you're at high risk of getting diabetes. And if you sweat out all of your calcium and magnesium and boron and zinc and sulfur and other minerals that are required for cartilage, ligaments, tendons, connective tissue, bone, you're going to get a joint and bone injury. What is the biggest single cause of an athlete's career being ended early? Joint and bone problems, right? And that's because they sweat out all the basic minerals that they need to maintain those parts of their body, and they don't supplement with them because doctors tell them that they can get everything they need by eating their 4 food groups. Well, what are the early warning systems for mineral deficiencies? We already told you about white, gray, or silver hair for a copper deficiency. Liver spots or age spots on the back of your hand, side of your face, or neck. These things are caused by a selenium deficiency. And you know, again, about selenium deficiency. Then, of course, you have toe cramps, leg cramps. You can have hypertension. These things are all caused by a deficiency of calcium. And if you're an athlete at age 25 or 15 and you get a leg cramp, there's a calcium deficiency, your body's telling you, if you don't stop drinking those Pepsis and start supplementing with some calcium, by the time you're 40, 50, 60 years old, you're going to have arthritis and osteoporosis. But most people say, well, I got to get this high-priced trainer. I need somebody who can give me massage therapy because I have a cramp. And they don't go and take their supplements. 85% of the total mineral in your body is calcium. There's 147 different diseases you can get from a calcium deficiency. We're just going to quickly go over the top 10 when it comes to number of people affected and the amount of money involved. Let's look at osteoporosis, the number 10 killer of adults in the United States. Remember, 75% of those over age 65 who fracture a hip or a major leg bone don't live 90 days. Also, it's the most horrible disease when it comes to human misery and dollars expended. Osteoporosis, think of the special vans and the lift gates and the ramps and the elevators, the special plumbing in homes and public buildings, special parking places, wheelchairs and walkers and canes. Think of the beds and the chairs that are little electric motors that lift you up when you can't stand up by yourself. Physical therapists, joint replacement surgeries, pharmaceuticals, doctor's visits. We're talking billions and billions of dollars for nothing more than a calcium deficiency disease. Now, as horrible as a disease as osteoporosis is in human beings, we don't have osteoporosis in animals because we don't have Blue Cross Blue Shield, major medical hospitalization, Medicare and Medicaid to pay for nonsensical surgical treatments for mineral deficiency. We've learned that by putting animals who are weaned off their mother's milk on calcium, as soon as they're weaned, they won't get arthritis and osteoporosis. It's amazing how that works. Receding gums. Dentists and dental hygienists will tell you to floss and brush after every meal. If you believe that works, I have some oceanfront property in Montana to sell you. If you have receding gums, periodontitis, gingivitis, pyorrhea, loose teeth, bridges and plates, you actually have osteoporosis of the facial bones and the jaw bones. We don't get receding gums in animals, even though they don't floss or brush. That's because we've taken care of the osteoporosis problem in animals. Arthritis. 85% of all arthritis is called wear and tear arthritis. Osteoarthritis, degenerative arthritis, ankylosing spondylitis. These things are nothing more than osteoporosis of the joint ends of the bones. Hypertension, high blood pressure, as you've learned, has nothing to do with salt or salt restriction. 85% of hypertension not related to kidney disease, which is most of them, not related to kidney disease, is in fact a calcium deficiency. Insomnia is not a deficiency of sleeping pills, Halcion or barbiturates, it's a deficiency of calcium. Kidney stones, bone spurs, heel spurs, and calcium deposits. Again, the medical profession has a malignant dumb belief that these things are due to too much calcium in your diet, tell you to give up calcium, when in fact you only get kidney stones, bone spurs, heel spurs, and calcium deposits when you have raging osteoporosis. You actually need more calcium, more magnesium, not less. Cramps and twitches. Raise your hand. How many of you have ever had a toe cramp, foot cramp, leg cramp in your life? Sure. That's the first symptom of a calcium deficiency that most people recognize. So if you've ever had that sometime in your life, you've had a calcium deficiency. Then you have PMS. The University of California at San Diego came out and said that 85% of the emotional and physical stuff of PMS can be relieved, eliminated, and cured. They use the cure word by taking 3 times the RDA of calcium. Low back pain has nothing to do with disc problems. I know you've heard of people, maybe even yourself, have had a disc surgery for back pain. And after the surgery, you still had the pain, maybe even worse, because back pain is not caused by disc problems. If you have a disc problem, you can have numbness and tingling, maybe even paralysis if it's very severe, but disc problems do not cause pain. We learned in 1957 in animals that we could prevent and cure adult onset diabetes with 2 trace minerals, chromium and vanadium. In 1985, the medical school at the University of Vancouver, British Columbia, up in Canada, came out and said the trace mineral vanadium alone could replace insulin in adult onset diabetics. Science Diet dog food has 40 minerals in it. Always has chromium, vanadium, lithium, and selenium. Ralston Purina laboratory rat pellets has 28 minerals, always contains chromium, vanadium, lithium, and selenium. I'll give anybody in this room a crisp new $100 bill if you can find me a human infant formula off the shelf of a grocery store that has more than 12 minerals in it. None of them contain chromium, vanadium, or lithium. Only one, well, 2 actually, Prozoibe and Infamil, I believe, has 12 because they put in the selenium. The rest of them don't. They have 11, 10, 9, or 8 minerals. Our dogs get 40 minerals, our rats get 28, and our kids get 12 or less. You don't have to be a research scientist to realize why our kids are now getting all these horrible diseases that used to occur in people in their 60s, 70s, and 80s. All these diseases that doctors are wondering, is this genetic? These kids shouldn't have this till they're 60. Well, that's because they couldn't get it out of their little can of stuff. If it's not in the can, they don't get it. Again, we need nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And fortunately, over the thousands of years that human beings have been around, we haven't had to think much about this because our food plants, our grains, vegetables, fruits, and nuts take carbon dioxide out of the air and manufacture long carbon chains, many of which are vitamins, amino acids, and fatty acids. And this is where this medical caca came from, that you can get everything you need from your 4 food groups, because they say, well, plants, grains, fruits, vegetables, and nuts can manufacture vitamins, amino acids, and fatty acids. But we've tried this experiment for 200 years. Americans have eaten better than anybody else in the world. We've had the best quality food in the world over anybody else, and yet we only live to be 75.5. We don't set any health or longevity records. So if you want to live to be over 100, can't get it from eating your 4 food groups. You can live to be 75.5. You may live 10 years older, 10 years younger, but on the average, 75.5. So if you want to live to be over 100, you do have to supplement with vitamins, amino acids, and fatty acids. There's 3 types of minerals that you have to concern yourself with. First of all, there's metallic minerals. These are things like oyster shell, eggshell, limestone, coral calcium, seabed minerals, clays of various types. Tums is a popular one with doctors. Lactates, gluconates, citrates, oxides, sulfates, carbonates. These are nothing but ground-up rocks. We're not designed to eat ground-up rocks. Nobody can show you where humans or animals are designed to eat ground-up rocks. We're designed to get our minerals by eating plants, grains, vegetables, fruits, and nuts. And as a result, plant-derived minerals are absorbable, more absorbable than chelated, more absorbable than the elemental or metallic minerals. Plant-derived minerals are liquid. They're very small particle size. They're 7,000 times smaller than a red blood cell. This is the way they're stored in your cells and are moved around in plant vascular systems and human vascular systems in the liquid plant-derived form. They're negatively charged. I don't know all of the physics and the chemistry. It's one of the basic features of a colloidal mineral. It's negatively charged. These three factors together give you absorbability. Now, the way it's supposed to be is our food plants, our grains, vegetables, fruits, and nuts, take the elemental or metallic minerals out of the soil, convert them to minerals for their own use, for their own metabolism and biochemistry, and then animals and people eat these plants that are enriched with minerals. That's how we're designed to get our minerals. Unfortunately, we have several problems here. For 100 years, we've used a simple fertilizer known as NPK. We put in 3 nutrients into the soil when we need 60 minerals. We put those 3 nutrients in the soil for maximum yields per ton and bushel per acre. Then, of course, we have to understand that plants cannot manufacture minerals. If they're not in the soil, they're not in the plants. Plants only have minerals in them if they're in the soil. Plants cannot manufacture minerals. Over 90 years at least, we've been deficient in our soils in America, and as a result, our food is deficient, and as a result, the crops, the grains, fruits, vegetables, and nuts that are grown there are minerally deficient, and as a result, the animals and people who eat these minerally deficient crops get mineral deficiency diseases, and the only way to prevent and cure them is with mineral supplements.